MEN1 is a genetic syndrome that's associated with neuroendocrine tumors. It's a mutation in the MEN1 gene, which is a powerful transcription factor that controls a lot of the cellular functions of endocrine cells. So in general, MEN1 causes tumors of the pituitary, of the pancreas, and of the parathyroids, the small organs that control calcium in your body. The most common presentation actually is with the parathyroids. People tend to come with elevated calcium levels. In fact, that's a very frequent way that disease is diagnosed. But they can have tumors in the pituitary up in their central brain, which will cause problems either with vision or maybe hormonal problems. And of course, they can have pancreatic neuroendocrine tumors as well. It is something that is passed on. It's well recognized. So if this is something that you've been diagnosed with, you certainly want to see a genetic counselor. And there are many specialists who take care of this. The next question, I'm sorry. Dipnech is a slightly different entity than just a typical carcinoid. Dipnech is something called diffuse idiopathic pulmonary neuroendocrine hyperplasia. So just imagine the neuroendocrine cells in your body actually have a very powerful and wonderful function. They help you breathe in your lungs specifically. And it's very important because breathing changes depending if you're lying down or if you're running up a mountain. Or if you're running up a mountain, especially in Denver, you may need more air in, and your lungs need to accommodate that. So when they function well, they're very important. But when they turn into tumors, it can be a problem. And that's what carcinoid is, bronchial carcinoid. Now, for dipnech, you can get a CT scan and see these tiny little freckles all over your lungs. And in fact, what they are is they're the little neuroendocrine cells, and rather than just being one or two next to each other, there may be 100 next to each other. And we call that hyperplasia, so some growth. But in general, they are cancers. They can grow a little bit larger than you would like, so they may be almost bordering on carcinoid tumors. But in general, they don't spread. But they can cause symptomatic problems to the patient. And so again, it's very good to see a specialist who's seen that case before to help you with your care.